Thanks very much. And thanks to TBA for inviting me to speak. Fairly broad topic, control of infectious diseases on stud farms. So what I'm planning to do is go over a bit of a sort of an overview of biosecurity, look at methods of disease spread, and then look at the main points that I think will be relevant to breeding premises. And then I've tried to kind of link it all together and give these specific examples at the end just to try and make it a little bit more relevant. So herpes, LAWSONIA, RHODOCOCCUS and rotavirus, things that we all know are very important, and just run through some of the more up-to-date information available, as well as some of the basics. Certainly herpes is behind a lot of the things that you do all the time on studs in terms of how you manage and control all your horses. So biosecurity is just about prevention of introduction of infectious disease into a population. So how do we stop it getting on in the first place? And then really the term biocontainment comes in, which is what happens if there's a breakdown in that system. How do we stop it from spreading from horse to horse to horse, so everywhere within your property, and from then sort of as well to members of staff and to people there. Now, some of the diseases that horses get, including things like salmonella, can certainly be spread on to us, and it's just always important to remember that when we're thinking about things. So I quite like this quote here from Niccolo Machiavelli from 1513. Hectic fever in its beginning is easy to cure but hard to recognise, whereas after a time, not having been detected and treated at first, it's easy to recognise but impossible to cure, which is probably something that we're all very familiar with. So that first case of whatever disease it is that rears its head, you're all sort of looking at it, scratching your head for a bit, but then suddenly you get more and more of them, and then they're very easy to spot. So you get your next one, you say, oh, I know what that is. And the point is, the quicker that you can identify this problem, and the better you can prevent the spread of the disease during that time, the easier it is to stop it from spreading to that next step where it becomes much more difficult, becomes established on the property in our cases. We don't have him anymore, but we have the HBOB codes of practice, which run through this, and is basically what underlies this, exactly the same. How do we stop the disease getting here? How do we recognise it immediately? And how do we bring it under control? So just a couple of terms I want to go through, things you sort of hear talked about when we speak about infectious disease. So contagious disease. So infectious diseases can be contagious or non-contagious. Contagious diseases can be passed on via a number of mechanisms. So the first one, direct contact. So animal to animal, horses rubbing each other sort of directly if they're housed together, and then moving all the way down to sort of a row of stables in this way. But as well, coming back to what I said before, diseases can be passed on to personnel, and pretty much every contagious disease that we think about is spread this way. It's a big method for things like influenza and strangles, herpes as well, but then the other things like rotavirus and ringworm can be spread in this way as well. Indirect contact, this sort of brings in the notion of fomite. So this is a fomite is basically anything and everybody. So everything that's in your tack room, feed bowls, troughs, people, and then sort of bedding, muck, that sort of thing. So depending on the disease, again, you can spread it between horses without them having to directly contact one another. Strangles is very good at doing this. Herpes is very good at doing this. Rotavirus as well. We know bedding is a big source of infection there. And it's important to sort of think about how these things are spread in terms of how is best going to be to contain the different diseases. The last one, which is important we think about for the most contagious diseases, is aerosol, which can be large or small, but these can be sort of spread over a very large distance. So flu is the best one at doing this. If you have one horse in a shared airspace, so in a barn that gets flu, every horse in the barn will get flu, no matter what you do and how quickly you move them out of there, they're all going to get it. Herpes also spread this way. It's not quite as good. It can spread up to about 50 metres at best. It's probably not usually that effective. And a few other things as well. So non-contagious ones. Non-contagious diseases need a specific mode of transport, of transmission. And there's two really we think about. One is vector-borne. So a vector is basically any insect that will transmit a virus or whatever you're talking about, and then venereal as well. So vector-borne, this can be mosquitoes. put malaria and I put Zika virus up there because everyone knows a bit about it at the moment. But West Nile as well, in horses and in people. African horse sickness spread by midges. Equine infectious anemia. This is spread more by biting flies, so you can your big biting stable flies, and also by injection. So if you're using the same syringe to inject a lot of horses, and also with blood products, you can spread equine infectious anemia around. Venereal, obviously more relevant to everyone here. CEM, EVA, EHV3, Durine as well. And obviously in the case of these diseases, the very specific mode of transmission being during breeding, so you can try and target and control them at that point, as well as beforehand, which I'll come on to. So this is a very important concept as well, is where does disease come from? So you've got your clinically affected horses. So this is a horse that's ill, it's a horse with a fever, the one that stood in the corner of the room with a snotty nose and looks terrible. We all know that those horses are going to be spreading things around at that point, and then for a period of time afterwards. Now, be that a few days, or things like herpes, they can shed it for up to sort of 21 days after they're beginning to look better. So you have to bear that in mind. The subclinically affected horse, subclinical just refers to the fact that the horse looks fine. And these are either horses which have the disease but have a little degree of immunity, but so therefore they don't appear ill, or it's the ones that have already recovered, as I said there. So vaccination or vaccinated horses can sometimes have this appearance that they're actually fine, or they look fine, but they can have a degree of infection which can shed, which is why you have to test vaccinated horses as well in some cases. And then the final one, carrier horses as well, slightly different, just to be very specific about it, to the subclinical ones. But carrier horses are infected but show no signs of disease, so they're not even subclinically ill, they're not even feeling a little bit rough, but you don't know about it. And these ones just harbour the infectious agent and shed it intermittently, often when they're immunosuppressed. So herpes, again, we'll come on to. With CEM, stallions don't show any signs whatsoever. Salmonella lives quite happily in the gut, but stress the horse out and they'll shed more. And strangles as well, which a lot of us will be familiar with, the idea of the guttural pouch, so the little area in the head here, and there's a little sort of ball of pus in this horse, which is where the strangles is living quite happily. And that's why we scope them if we suspect disease, and we scope the guttural pouch to see if we can find this and take the samples. Put biological products in there that's more important if you're looking at AI, just because of that as a potential source of infection. Get the hang of that in a sec. So to sort of tie it together a bit, looking at some general biosecurity points, you'll all be very familiar with these. And I didn't want to just give you a list that you'll all have seen before, but you can appreciate that to stop the indirect spread of disease, you can wash your tack, you can not use different tack between different horses. If you could even cut it down to tack being specific for different groups of horses, or bowls for different groups of horses. And you can appreciate that way you'll stop the spread from one group to another. If you clean things regularly, although yes, there's going to be a bit of spread maybe between times when you're cleaning, if you do that, then it's going to help break the cycle of transmission at various points and at various times. So if something does rear its head and it's been around for a week or so before, maybe you've managed to sort of break the cycle. Protect horses from biting insects. That will probably become more important in the future when these some of these more exotic things become a bit of an issue for us, which they probably will. So West Nile jumped into the States pretty quickly and spread all the way across, and we have it well established in Europe, and we have mosquitoes here that can transmit it, so we're sort of just waiting on that. Fix your drains, leaking taps in puddles, breeding grounds for mosquitoes, great for salmonella as well, stagnant water. Get rid of your muck away from horses and watercourses. Muck disposal, especially from youngsters, very important, not to put it on your pastures, we've already said. Minimise visitors onto the premises, and vermin control as well. So cats will get rid of rats and mice, but they do spread things around themselves. And chickens, people seem to be particularly keen of in some places, but they're moving around from stable to stable. Giving us its own slide, and it genuinely is that important, although we all continually forget about it. It's pretty much the most effective way of stopping the spread of infectious disease. Ideally before and after handling each horse. Well, if you're not going to do that, do it between groups of horses, because I'm sure you're all in places where they are housed in groups and kept in groups. If you can do it at least between them, it will be very beneficial to stop disease spread. Alcohol hand rubs are great, but they don't work if your hands are really dirty. So if you can at least rinse most of the dirt off them, but if you've got dirty hands, then just sort of slapping it on won't help. Gloves are great, but you have to remember to change them. When you're wearing them, it gives this kind of sense that your hands are clean, and then you sort of forget, and you'll go from horse to horse in that way. So just keep changing them. So a few specific points, breeding premises, and these are things that we're all very familiar with. So that first question, biosecurity, how do we stop infectious diseases getting onto the premises? Only healthy horses should come on. So veterinary certification and testing is key. It depends a bit on your population, whether you've got high risk, low risk horses, whether you have a lot of transient horses, mares coming on, how much you test and exactly what you test for, and it needs to be specific for your own setup. But we're used to the idea, really, horses should be vaccinated for sort of influenza at least. It's a bit simpler here than it is in the States, what we consider a core vaccine. Your EVA and your EHV obviously depends on your exact setup, and I'll come on to EHV a bit in a sec. Blood sampling again, and swabbing, everyone's familiar with that, and CEM, Pseudomonas, Klebsiella, before they come onto the yard. It's worth remembering that although we're very used to this system, it is very effective. So the last case of CEM, I think in the UK, was 2012 or something, and other than that, it doesn't sort of crop up very much, and it is very well under control, and it is just because you're constantly doing this and helping to prevent the spread in this way. I've put isolation there in big letters, and then I'm not talking about it very much, really, because that would take forever. Isolation is very important when you're bringing new stock on. It's not always something that's feasible. I'll speak about it briefly when we're talking about herpes again. But if you can isolate as a minimum for 10 days, ideally for a couple of weeks when new stock comes on, then during those 2 weeks you can sort out your worming, you can test for certain things, especially strangles, and a lot of things that are going to rear their head will do so during that time period, and you can keep them away from the rest of your herd at that time. During breeding, just make sure everyone's aware of the risk of direct and indirect disease transmission. Wear gloves when handling tail or genitalia. This is all stuff people are going to be very used to. Remember to change the gloves between the horses and use different equipment and water for each horse. And so just because these horses have been tested beforehand and come back as negative doesn't mean that there isn't the odd one that will slip through the net. And this is kind of your next step in terms of controlling it and preventing the onward spread. So all these things are very important. So just to run through those 4 examples now, we'll start with herpes. So respiratory disease, abortion, and neurological disease. Really, we're just looking at EHV1. EHV4 is just for the respiratory disease for the most part, and isn't that much of an issue to us. We don't know why certain strains of EHV1 cause abortion and neurological disease. We have a lot more idea than we used to, and probably getting closer to working it out, but there are not just specific types, and we can't test for those specific types. We did have there was a specific sort of mutation that was identified, but it's not clear cut, and a lot of things without it will cause a lot of problem as well as with it. The important thing about herpes is it's completely endemic in the UK, which means it's everywhere, and just about every horse will be exposed to it at some point. This brings up a few problems, like you can't test for antibodies to see if a horse is infected, because every horse pretty much carries the antibodies and are infected as youngsters. What herpes has, and it's the same as every herpes infection, is latent infection, which is key to understanding it and to trying to work out why we manage a lot of the horses as we do in their various groups, and why, if you have an outbreak of herpes, it's very difficult to bring under control. So it's directly and indirectly transmitted, and also slightly via aerosolization, as we said. goes in via the respiratory tract or is ingested, and then the virus can then go into 2 cycles. And the first one is a lytic cycle. So lytic just refers to the fact that the cell ruptures. So that's the one when you get disease. So the cells are infected, the virus replicates and bursts the cell. So you either get your respiratory disease. If it heads to the sort of the placenta, then you get abortion, or it goes to the central nervous system, usually starting off at the spine, and you get your neurological signs. So that's the lytic cycle. But what herpes can also do is form a latent cycle whereby it basically hides out within the cells in the body and hides completely from the immune system. And it reactivates at times of stress. This is human beings, an equivalent is shingles. I don't know if you've had it or know anybody who gets it, but all that is it's a herpes virus that's hiding in part of your nervous system, and you get very stressed out and it starts to cause disease. Horses, when they have a latent cycle, they can show signs of disease or they can look completely normal. So the horse gets stressed and will start to shed the virus in big numbers via the respiratory tract, and it will then go on and infect other horses. So a bit of a busy slide, but I want to sort of talk through it as best I can. Probably best that we start here with this mare. So this is on the property. Could have been there for years, could have just arrived. And what happens is the mare gets a bit stressed out, looks absolutely fine, and starts to shed the herpes. So the herpes virus comes out of the nose, and these are all the other horses that are in her group. And this is kind of the possibilities that you can get with herpes. Now, she can also reinfect herself, but one option is that this other horse has a bit of a snotty nose, maybe develops their own latent infection, but they have a completely healthy foal in a few months' time or whatever, and there's no issues. Another option, which we'll just have a look at down here, is that if she infects another horse, but for whatever reason the virus decides it's going to go and get to the nervous system, and you get neurological disease and death, and everything's pretty catastrophic. Other option, the virus, for whatever reason, I say we don't know, goes off to the uterus and causes abortion a few weeks later usually. Or option B is a very weak foal. It's born with herpes, which will die. There is absolutely nothing you can do about that. You can try as hard as you can, but these foals will all die. And in the meantime, these mares will all probably shed a little bit of virus via the respiratory tract. In the case of these two, we all know the foal, the placenta, the afterbirth, everything's highly infectious. So this would probably be the point when you would realise something had happened. So you've got the mare and she's aborted and you've gone, shit, what do we do now? So you do, things kick in, you bag up everything, you clean everything, you get rid of the aborted foal, and you've got all your sort of things that you kick into motion. Maybe that goes off for testing. But the point is that you can put in all the sort of isolation sort of things that you want, and that will then prevent spread from that mare because she will still be shedding out of her nose and various things like that. But the next thing that happens is another mare in the group who you think hasn't had anything to do with this foal since then aborts. And the point is that mare got the infection from this mare at the same time that this one did. So there's nothing you could have done about that. So the thing is not to get disheartened by it. And the group, I know it's easy to say, but the group that these are in, you've got, if you can split that group down a bit smaller, but effectively that group has probably been infected in the past. Now it can be affected more by all this stuff that's going on and the afterbirth and everything else. So you have to have the biosecurity measures there and step everything up. But you have to bear in mind that the chances are that more mares will abort within that same group, and that's because of something that happened in the past. But because of the way you house the mares and because they are in groups already, you're limiting it to that group. So that's why we do that. And it's, as I say, it underpins a lot of what you do every day, but that's why it happens. In terms of the other thing you need to do as well, obviously, is keep them well away from all the little young stock, and that's because probably around the time of weaning, we think that the mare maybe is a bit stressed as well, or before, and will be shed a bit of herpes virus, which will infect her foal at a young age. They just get a bit of the snots, and they come over and when they're weaned, they hang out with all their mates, and they all get a snotty nose, which we're pretty familiar with, cycle it round and around and around. And that's why we have to keep them as far away from any of these mares as possible. Also why, if you bring a mare on to the property later on, we say in that case to really try and house them differently, or to isolate them before they go in, because the chances are if they're going to shed and you can't test for it, they're going to shed early on when they first get there. And that's why we try not to affect the dynamics of these groups, because you can have a latently infected mare, but if she's not stressed, she won't infect anything else. So I hope that makes sense. It's quite complicated, and there's a lot of other different things that can be going on at the same time, but it just sort of underlies a lot of things. So why don't we test mares before they arrive? As I've said, antibody tests are useless because nearly all horses are positive. You can't differentiate between the ones that cause the strains of the virus that cause a problem and the ones that don't. And the latent stage can be completely undetectable anyway. So you could almost have a very low antibody level anyway, and it could still have a latent infection. I've already mentioned that about isolating and testing. But this is why vaccination is so important with herpes, because there's always going to be that gap between that sort of gap that I mentioned there, between finding that first one and working retrospectively and saying, right, well, the biosecurity becomes a little bit sort of retrospective. So we've got the inactivated vaccine in the UK. They've got different ones in the States. Not going to go into whether or not it happens to be available at the moment. It's licensed to reduce the respiratory signs in the youngsters. I think probably more importantly, reduction of abortion. And we're all quite used to that, months 5, 7, 9. Does it work? When a few of the studies are quite old, but they did some work originally, and they had 2 groups of mares, vaccinated, non-vaccinated, and they purposely infected them with herpes. And there was I think something like 1 in the vaccinated group aborted, and all the ones in the non-vaccinated group did. So yes, it has been very effective. Some studies have shown less effect. What we do know is that since we, a long time ago, say we, nothing to do with me obviously, but since it instigated vaccination along with all the sort of the housing arrangements, there's been a huge reduction in herpes abortion in the UK and in the States as well. And you know, if you look at the time frame that's been done, this big drop means it's hugely likely that this has contributed significantly. What's important, the vaccine doesn't 100% prevent abortion. Nobody would pretend it does. And every now and again, there will be a strain of the virus which gets around it. And you'll have abortion occurring in vaccinated mares. In that case, it is important to report it as you sort of meant to, and to let the manufacturers know so that they can find out if there's anything about this strain or if there's anything different about what's going on. Because if we can find out exactly what strain it is that's caused abortion and has got round the vaccine, you can appreciate it's very important moving forwards. Herd management, I've kind of covered a lot of this as we've gone through, but effectively, as you say, this is all laid out in the codes of conduct, and it's how most of you will be very familiar with things. A couple of pointers. Just remember about your high-risk things, and that includes foster mares. Like, why did the foster mare's foal die in the first place? If you don't know, which you very often don't, then just bear in mind that you do have to be very careful with those mares, and potentially whether you want them to not come on the property at all. Keep the stallions completely separate, use separate staff. So another little point people probably mention or think about is, do you start doing a lot of extra testing during outbreaks? And for sure, it will help you to bring things under control more speedily and will allow you to declare that you're disease-free much sooner. You gather information together, which can be used, again, looking at things from the whole picture, and we're all here, can be used in future outbreaks, and it helps with the vaccine companies to make them aware. There's a cost with it, and I appreciate that it's usually a big cost, and it's at a time when that's the last thing you want to be facing. You don't want to be asking people owners for money to be testing for this, and I appreciate all these concerns. None of the methods are 100%, and there's always going to be things that can slip around them. And it's only worth doing if you can actually act on the results. So that means if you have the resources and the space potentially to split your groups up, depending on the results of your tests. If you can't split them up, then you're better just keeping things in the groups that they're in. There's a 3-tiered system which has sort of been suggested for this, so bronze, silver, gold standard. Obviously that's cheap, okay, and extremely expensive, so the other way of looking at it. But it does allow you to find out when mares have stopped shedding, and that's the important thing again. Up to 21 days after having a fever or aborting, they will potentially be shedding herpes. And if you do the testing, you can find out a lot sooner. But that's something that I think bear in mind, but obviously, hopefully, fingers crossed, it will never be something you'll have to deal with. But it does very much help. So moving on from herpes, just want to chat a bit about Lawsonia. Some of you, I'm sure, will already have encountered this. Hopefully, quite a lot of you haven't yet. But it's a bacterial disease. It's not inflammatory. What actually happens is you get a rapid growth of some of the cells in the small intestine, and they sort of multiply and multiply. And this prevents normal absorption of nutrients and also actively secretes nutrients into the feces. So you get these sort of ill thrift, weight loss, fever, diarrhea, usually at least 2 or 3 months old. The diagnosis, I'm not going to go into much, and the treatment by antibiotics, I'm not either, because I want to just talk a little bit about how we can try and control it in other ways. Importantly, they seem to sell for about 30% less at the sales, although they do race just as well, it would seem. So where does it come from? It's a disease we know very little about. There's an equivalent disease in pigs called porcine proliferative enteropathy. And we know a bit about that, so we basically extrapolated things, certainly initially. It's very widespread, so horses all over the place have antibodies. It seems to vary between sort of 15% and 100% of horses on a property will have antibodies to Lawsonia, but only about 10% of horses that have antibodies will develop disease, and we don't know why that is, to be completely honest. We know it's spread by the fecal-oral routes, so if you feed this, or if you give foals this orally, then they will develop the disease, and that's how it spreads between foals. Pigs initially were blamed as probably being the source because of the similarities with the bacteria. It's the same bacteria but a different strain, although we basically don't blame pigs anymore because so many horses have developed this disease that have absolutely no access to pigs. Probably what's most likely is that there's a role of rodents. Certainly rabbits, infected rabbits' feces have been used to infect foals. So rabbits get it, and if you have rabbit feces, and they've done this with levels of the bacteria in them, fed them to foals, and they've gone on to develop a form of the disease, not the really severe form that we see. So essentially the message there would be, if you're having trouble with Lawsonia and you have a lot of rabbits, get rid of the rabbits. Would be a very sensible thing to do. In pigs, the sow seems to shed the bacteria, which maybe is how things get triggered off in the first place. We haven't really been able to establish if that happens in horses yet, whether mares are shedding it and are causing the problem to appear. And it seems that the level of antibodies in mares doesn't tie in with how likely their foals are to get the disease. So we just don't know, is the honest answer to that. So that's not very helpful for giving recommendations, but that's all we can say at the moment. Testing horses is of no use because, as I've said, some seem to come up positive. It doesn't tie in with anything. Appropriate disposal of foal muck, we should be doing that anyway for reasons I've already mentioned. Avoiding overcrowding, stressors, coming back to making sure that worming is appropriate. That's a stressor if they're already dealing with a worm burden. The idea about plasma, it seems that the amount of colostrum-derived antibodies against Lawsonia isn't too important. This is no way to take away from the importance of making sure that foals have adequate colostrum, but it seems that specifically for Lawsonia it's not actually that useful, and that probably means that if we had, say, Lawsonia specific plasma, that might not be of that much use. We'll come on to that a little bit with RHODOCOCCUS later on. I think what is good, though, is that we do have a vaccine which seems to be very effective. So it's not licensed for horses, it is the pig vaccine. It's orally in pigs and intrarectal in foals. It is extremely effective. They've done plenty of studies on safety because obviously it's not made for horses. It seems to be fine. And in all the studies, it was very effective at reducing the clinical signs of the disease, as well as improving daily weight gain in those foals compared to untreated controls in the same places. It's hard to do a specific study on a yard to say it works because Lawsonia varies a lot from year to year where it's endemic, but anecdotally it has been very effective when used sort of large scale. and there's lots more people are using it. You have to time your doses sort of correctly regarding when you have your high incidence of Lawsonia on your property, but that's something you can sort of work out with your vet and sort of time in from that. But it's very good news that it does seem to be effective at a time when we know very little about the disease. It's a good thing, really, that they know more about it in pigs, and they've been able to come up with this, to be honest. Rhodococcus, again, a lot of you, unfortunately, probably quite familiar with this. Bacterial pneumonia, also gastrointestinal disease, joint swelling, uveitis as well. Not all the lungs look that bad. That was clearly as a post-mortem on a foal we had in. It's amazing the foal managed to survive at all. We couldn't really find any normal lung. Treatments with antibiotics and resistance to the antibiotics for rhodococcus is about as big a problem with resistance as you can get. And the overuse of the antibiotics we use for rhodococcus is a big concern as well, because they're the same ones that are used to treat TB in people. So we really actually don't want to be using them very much, and if we're developing resistance, then rhodococcus bacteria can transmit that same resistance to other bacteria, so bacteria swap things around between them. So it is a big problem and something we do need to be aware of, and the question should always be, what can we do to avoid having to use any antibiotics at all? Surviving foals seem slightly less likely to go on to race, but they do seem to race as well as non-affected horses. Obviously, that just depends on the spectrum of disease that they get. So, coming back to sort of the disease control and biosecurity, where does it come from? Again, rhodococcus seems to be everywhere in the soil. There's only certain strains of the bacteria that carry what we call virulence proteins, which are encoded by a VAT plasmid. So plasmid is just bacterial DNA. And so if they have certain DNA, it allows them to develop these virulence proteins which cause the disease in individuals. This all seems great, but unfortunately there doesn't seem to be any association between whether you have these virulent strains in the soil and you have any disease on the farm. And it seems to crop up sporadically and in varying numbers, with no real correlation to whether or not these bacteria are around. The main source where it's endemic seems to be the feces of infected foals. So they're spreading it around, and then it dries in the ground and is breathed in basically by other foals. And it's also been more recently sort of established that infected foals also shed it in their breath, so they are therefore directly contagious to other foals. This does bring into question a few of our ideas about whether or not, or what you need to do with a foal that has rhodococcus and how infectious it is to other foals. Probably very is the answer, but the problem is that by the time you have it, the bacteria is probably everywhere in the soil anyway. So trying to isolate that one foal is unfortunately very rarely effective. We know that there's these hotspots on different farms, and these are high-risk areas that where they know that if foals are kept or encounter, they're more likely to get the disease. And they're the kind of standard things you'd expect, so where you've got lots of mares and foals, high stocking densities, indoors versus outdoors is a massive risk, but that's the same for most diseases, unfortunately. Dusty areas, because you're going to have more aerosolized muck. There's a lot of conflicting results as well, and that probably comes from the fact that a lot of studies are done in Australia and Kentucky, and then the climate and the different risk factors are obviously very different. So what can we do? Immunoprophylaxis. So the vaccine, there are vaccines available. They're currently rather unconvincing, and that is potentially going to change. There has been some more recent work that's been a little bit more promising, but at the moment we can't rely on that. Hyperimmune plasma may or may not be something that people use. You can get it specifically made for rhodococcus. It's pretty pricey, and we're not quite sure how it is best to be used. There's a couple of studies have shown quite a significant beneficial effect, and there's a few studies have shown no effect whatsoever. It seems it's probably not that important to give it to newborns. Probably when they're sort of 4 to 6 weeks old is going to be more beneficial. There's a lot of strain mismatching. The antibodies aren't quite right for the rhodococcus that you have, and certainly there's some very recent work they've done in the States showed that the different products you can buy are actually very variable, unfortunately, in terms of what's in them. But over here in the UK, we're a bit more limited in terms of what we can buy, so that's less of an issue. Screening, I'm not going to go into too much because that's really something that you need to discuss with your vet. It is very much recommended if you have a property where it's endemic. Stockmanship is absolutely critical no matter what we do, and then it just has to be tailored around what is appropriate, what your risk level is, what you can afford. And it's either really via bloods or by ultrasound screening. Blood tests are a bit non-specific. They look at sort of inflammatory markers in general. Ultrasound at least looks at the chest to see what sort of disease you have. But you have to very much put it together, decide what your cutoff is going to be, because there's been plenty of studies out there where they've shown if you just use ultrasound screening and treat them based on that, then probably 80% of the ones that you treat were going to get better anyway, which obviously isn't what we want in terms of overusing antibiotics. And it's something that there's no point in me sort of putting up a recommendation here because it has to be very individual. Again, advice on husbandry. This is very difficult because basically the only thing that's been shown, this was in Australia, is that if you irrigate the high-risk areas with lots of dust, then you get a reduction in risk. Everything else, so it just comes back to what we know about the risk factors and trying to reduce them, but every time they try to do this, it doesn't seem to make a detectable difference, and I think this is because just of the difficulties in what actually the underlying problem is on different places. But obviously improving air hygiene, improving your hygiene indoors, getting rid of infected foals muck as quickly as possible so it can't be aerosolized, reducing stocking density where possible. You know, it's very difficult. Avoid spreading the foal feces on the pasture again, keeps cropping up again and again, and avoid commingling of groups and foals. So maybe if you can keep your groups separate all the way through, then you're less, again, it's, well, one group gets infected, hopefully the other group won't, which I know always sounds a bit harsh, but certainly if you're looking at the whole picture, might be sort of the best thing that you can do. Last thing I'm going to talk about is rotavirus. Where, again, probably a lot of you are familiar with it. Highly contagious diarrhea in young foals. High morbidity, low mortality. So basically most foals that contact the virus will get the disease, but in most of them it just causes mild diarrhea. Young foals, we certainly know though they can get very dehydrated and need fluids, etc. Treatment's fairly straightforward. Where does it come from? We still don't know the natural reservoir. So the first time it crops up somewhere, everyone's usually left scratching their heads and we don't know. Mares do shed it subclinically and they are involved in the cycle, we do know that. You can't really test them before they come in or anything, no. Infectious foals spread huge amounts, so once you've got one infected foal, it's the virus is in the feces in huge amounts, and it will continue to be in the feces for about 3 to 5 days after they look absolutely fine, so after the diarrhea stops. And it can survive up to 9 months in the environment, which makes things difficult to bring under control. Overcrowding is a significant risk factor, which you can understand when it's, you know, just something that's pumped out in the feces the whole time. So feces and bedding are the major biosecurity risk. So what you need to do is really ideally properly isolate these foals. At best, the people who handle them, you need a foot bath, you need gloves, and ideally some sort of protective clothing. But, you know, again, practicalities come in. But you can appreciate how important a foot bath is in those first couple of days. That first foal gets diarrhea, and if you've been in and around it, you're going to spread it to all the other places unless you have foot baths again between your different areas and your different groups. And you can appreciate that, again, before you get that diagnosis, you kind of prevented the spread if you've washed your hands and dipped your feet between different groups. Restrict the movement of horses and using correct disinfectants. We're still honestly not entirely sure about which ones are the best. Some of them say specifically that for rotavirus. On that note, I just want to say about effective cleaning, which sounds like a bit of an obvious thing, but if you remove all the organic dirt, so all the dirt you can see from a stable, you get rid of 90% of the organisms in there. Disinfecting, you kill another 7%. If you steam clean, you kill another 2%. You can't ever make it sterile. But the point is that getting rid of the stuff you can see is the most important thing. And a lot of the disinfectants don't work if there's any muck around, any organic matter at all. So you sort of, unless you've really got rid of all that dirt that you can see, using a disinfectant to try and clean is very ineffective and will not be anywhere near as good as it should be. Vaccination, given to mares during pregnancy, and has been shown to reduce the risk of diarrhea in the foals. There's one study there saying 30% versus 80% of foals. So that's, you've got two groups of foals, vaccinated and where the mares have been vaccinated or not vaccinated, expose them. You still get diarrhea in 30% of the ones that are vaccinated. All vaccines, you've got to bear that in mind, they're not 100%, but against 80%, that's pretty good. It seems to reduce the duration of the diarrhea in some studies from from about 5 to 7 days down to 2 days, which is good, because that's obviously going to be very beneficial for the foal and reduce the amount of virus that's chucked into the environment. I've stated those studies there. There's been other ones done which have shown it to be less effective. In some studies it makes no difference, and in other ones it's kind of somewhere on the spectrum between those two. Has to be used together with good husbandry, basically. It's not just going to fix things unless you're doing everything else and keeping things as scrupulously clean as possible. So that's sort of it really in terms of the run through. Key messages really being a lot of infectious disease is spread by horses that don't look to be ill. All the testing that happens beforehand and then what you do when the horses are on your property will prevent them from coming in. And just remember about all the things that you do day to day, and hopefully I've sort of reminded everybody just how important they are in terms of reducing the spread of a disease that you're not yet actually aware is present. Because the key thing for all of you is to get your place open for business as quickly as possible, and not have, it's very difficult to hide infectious barriers and all the rest of it, and it looks dreadful. So I appreciate that's got to be kind of your main drive, and if you can have as many things in place before the problem comes in, it makes it a lot easier in the long term. Thank you.